So recently we got a query, a very basic query, which is what is a mummy makeover? In a nutshell, mummy makeover is trying to correct all the changes which have happened during your pregnancy and your childbirth. So what are the changes that happen most commonly during your pregnancy? One is your weight gain, then second is because of the rapid weight gain, stretch marks, and then you have a pregnancy, so your tummy is growing, so there is a loose muscle, and then that changes your other parameters in your breastfeeding, so your breasts are enlarging and the glands are enlarging, so they replace the fat. So after the breastfeeding goes, then the breasts tend to sag or become empty, and there are some pigmentary changes which happen because of the hormones, and because of the childbirth. If you're having a natural childbirth, then you have a certain stretching of the perineal tissues. So all these are the changes that happen during pregnancy. So yes, many of the women say that yes, pregnancy scars or stretch marks are their war scars, and yes, they are war scars, and we are thankful for you for that, but you don't have to go through life with them. Yes, there are certain things that you cannot do or cannot change, and we have to live with them. But yes, if you can make we can do something which can help improve them or help you lead a more productive and full life without those issues bothering you, then why not? So that is where the mummy makeover comes in. So the basic or the gist of the mummy makeover is basically two procedures. That is your tummy tuck, which is combined with the liposuction of the surrounding areas. So there is a loose muscle, there is a loose skin, stretch marks. So all that is removed and your tummy is tightened and your muscle is tightened and the fat is removed, and then the skin, excess skin is also removed and tucked in. So that is a tummy tuck or an abdominoplasty. The second procedure most commonly done along with it is a breast procedure. Most commonly it is a breast lift or with an augmentation, because most of the women that post pregnancy and breastfeeding, the glands enlarge, so the fat gets replaced. But once the glands involute after your procedure, after your breastfeeding is done, the fat doesn't come back. So it's like a bigger bag now with less amount of stuff in it. So that's why they have empty bags. So that is where you have to either fill in volume, which can be either done with a breast lift or with a breast lift and an augmentation. So these are the two main things. Along with there are a lot of ancillary procedures that you can do. You can do a Brazilian butt lift. When you're doing a lipo, you use the same fat to use the Brazilian butt lift to give you a better curve or a differentiation between your waist and your hips. And you can do we can do some ancillary other procedures like pigmentation issues, then you correct that. Then you can do vaginal tightening, you can do vaginal rejuvenation, and of course labiaplasty. Sometimes the lips are big, we need to do that. So these are all the other accessory procedures that you can combine with a mummy makeover. But typically mummy makeover is two procedures, which is an abdominoplasty along with a breast procedure.